Kia ora koutou katoa, good afternoon everybody. I'll provide an update on the vaccine rollout, a bit more information on the vaccine program for our border workers in particular, and also provide a few more details on managed isolation and the pilot that we announced earlier this week. But first I'll hand over to Dr. Bloomfield for the update on today's cases.
Thank you, Minister. Tēnā koutou katoa. So today we're reporting 45 new cases of COVID-19 in the community. All are in the Auckland region. That takes our total number of cases in this outbreak to 1,230. It won't be lost on you that this is the largest number of cases we've had for some time. So I will go into a bit of detail based on the most up-to-date information that I have. First, 33 of these new cases are known to be household or other close contacts of existing cases, and many of them have been isolating throughout their infectious period, either at home or in an MIQ facility. Of these, 26 are household contacts, and 12, for example, come from just 2 households where there are 6 in each. Now, many of these cases were expected. On Monday, I indicated there were between 45 and 50 cases at that time likely to arise amongst household and other close contacts who had already been identified. We're seeing some of those come through in the number today. Now, presently, there are 12 cases that are unlinked and interviews are underway, but what I would say, for 6 of those, there are already potential links visible. Now that Auckland is at alert level 3, some of our cases today may have been working in essential or permitted businesses. These are the ones we haven't yet interviewed or are being interviewed during their infectious periods. This emphasises the importance of everyone in Auckland continuing to abide by alert level 3 measures. They are there for a reason, and this includes mask wearing and, importantly, minimising contact with others, staying in your bubble as much as possible. And alongside that, I want to make a call out to all employers in Auckland to actively support any of your staff who are not yet vaccinated to get vaccinated today. So while the overall number today is obviously a lot higher, it is important to note many of these cases are linked to our existing cases, and in some sense they were expected. But even more important is that we found these cases because people have come forward and been tested. This is essential for us to know what we are dealing with, and high levels of testing across Auckland tell us that. So thank you to everyone again who has been or is being tested. Our health staff from the Māori and Pacific providers in Auckland, our public health unit and the DHBs continue to work with households and groups to support them to stay at home when they are isolating, and many other agencies are involved in providing support as part of that. Yesterday I mentioned as part of the ongoing outbreak response in Auckland, we are extending our surveillance testing to businesses where workers are permitted to be at work during alert level 3. We're asking workers, particularly in construction, hospitality and retail sectors, to get 2 tests at least 5 days apart over the next couple of weeks, whether they have symptoms or not. This is just part of our overall testing to help us identify whether there are any chains of transmission out there that we are not yet aware of, and help us assess the level of risk there might be there around undetected community transmission. I would like to emphasise this testing is voluntary, it is not required. But I'm encouraging employers to support your workers to participate in this. In addition to GPs and urgent care clinics, there are 21 community testing centres open today around the Auckland region, so no one should have to wait very long at all for a swab. And some larger workplaces also have testing available on site for their staff. As this is surveillance testing, staff are not required to isolate while awaiting the result of the test. They can continue to work unless, of course, they have any symptoms. The groups who are already undertaking surveillance testing, such as permitted workers who are crossing the alert level boundaries or border workers, do not need to undertake this additional testing. An update on the Tauranga wastewater result. The Bay of Plenty DHB has seen a slight increase in testing numbers, with around 400 people tested so far. However, we would like to see more, and I'm just emphasising for anyone in that Tauranga, Mount Maunganui region, if you have any symptoms, then please go and get a test. Indeed, if you have been at a location of interest also. There is extended testing and testing hours across Tauranga today. There is plenty of capacity there. I'd also like to urge the people of Tauranga, indeed anywhere across the motu, if you haven't already been vaccinated, now is your opportunity to do that. In Tauranga, there are plenty of sites available today where you can just walk in and be vaccinated. Go for it. Now, one of the cases being reported today is an individual who attended the emergency department at Waitakere Hospital on Saturday the 25th for a non-COVID related condition. They became unwell the next day with COVID-related symptoms and were subsequently tested with a positive result returned yesterday afternoon. As part of the usual precautions, as the person's infectious period included Saturday, a small number of staff have been stood down, and the public health unit up there is following up directly with a small number of patients who were in the vicinity of this person when they were in ED. That person is now no longer requiring hospital level care and is going to a managed isolation facility. And finally, a shout out, it's great to see Canterbury businesses joining forces for a COVID-19 vaccination campaign that aims to get 90% of eligible Cantabrians vaccinated by Labour weekend, which means they will be fully vaccinated for Christmas. The DHB has thrown its support behind the campaign. Currently in Canterbury, there are 80% of eligible people having had at least one dose or being booked for their vaccination, so keep up the good work, Canterbury, and I'm sure other provinces around the country will recognise this as an opportunity to take it to Canterbury and beat them there, as well as give them a good run for their money during the NPC this year. Back to you, Minister.
Thank you, Dr. Bloomfield. Moving on to vaccinations, 44,000 doses of vaccine were administered across the country yesterday, and I do know that there's huge interest in the number of first doses and the way we're tracking there. Nationally, we have now around 78% of the eligible 12 plus population having had their first shot, and we're now seeing real growth in second doses and consequently full vaccination. In the last 7 days, the number of Kiwis that have had their second dose has increased by almost 200,000 to 1.8 million. That's 44%, so we're getting close to half the eligible population being fully vaccinated. I can't overstate the importance of those 1.8 million people now being fully vaccinated. It is a significant step towards the ongoing protection of New Zealand against COVID-19. Second dose vaccination bookings indicate that we're going to see a peak of second doses around mid-October, 6 to 8 weeks after the record numbers of first doses that we saw in that late August, early September period. 55% of Māori have had their first dose, 29% their second. Amongst Pacific people, 71% have had their first dose and 40% their second. The 92% of over 65s deserve a particular shout out for getting their first dose. 82% of them have had their second. For those aged between 40 and 64, the numbers are sitting at 82% for first dose and 50% for second. In the Auckland metro area, a total of 1,868,161 doses have been administered. 682,000 people have had both doses. As at midnight tomorrow, the requirement will come into force for all border workers and roles where they might come into contact with COVID-19 to be vaccinated. This greater protection at our border gives us confidence that those people who are going to work and doing jobs that potentially bring them into greater risk of contact with COVID aren't then going to get sick or die from COVID or pass that on to other people. If we've got another international ship, for example, present with the virus in our waters, or if we have an incursion at our airport or at an MIQ facility, there's high rates of vaccination provide us all with that much more assurance. It also, of course, reduces the possibility of community transmission of COVID-19. So I'm incredibly proud of the work that our border workers have been doing to ensure that they are getting on with the job and getting vaccinated to protect themselves and to protect others. As at this morning, 98% of active border workers have been vaccinated with at least one dose, and 93% are fully vaccinated. That includes 95% of our port workers, which is a significant advance from July when that number stood at 55%. There's been a lot of work done with that group to ensure that they're given good, accurate information so they can make informed decisions around vaccination, and we are seeing much bigger rates of vaccination amongst those workers as a result of that. So I want to thank everybody that has been involved in that effort, from our DHBs to the employers, the unions, the border workers themselves. A big thank you. I do want to remind anyone who works at the border but is yet to be vaccinated that they now have 24 hours until midnight tomorrow night to get their first vaccination if they wish to continue to work at the border. Today I can also confirm what I announced on Friday. The Cabinet has now formally signed off the funding for a new MIQ facility at the Elms Hotel in Christchurch, and work is underway to get that stood up as quickly as possible. There are, of course, a lot of complexities to work through when standing up a new MIQ facility, but the Elms will add another 85 rooms, which is a welcome addition to our MIQ network. Moving finally to the self-isolation pilot. Expressions of interest for the self-isolation pilot open at 9 a.m. tomorrow morning, and we'll be looking for 150 participants across Auckland and Christchurch. These locations both have obviously international airports, but also established MIQ systems and support networks that have been set up for regular international arrivals, and that's why we've chosen Auckland and Christchurch. Participants will have to self-isolate for 14 days in an approved residence. For this pilot, it has to be a standalone residence, have no shared ventilation system, and be within 50 kilometres of either Auckland or Christchurch Airport by road. It must also have cellular coverage. No visitors will be allowed on those premises while the people are isolating, aside from medical staff for testing purposes or those attending to someone in an emergency situation like a fire or ambulance people, or tradespeople if there are critical things that endanger the health and safety of people isolating. Those isolating will have to provide their own food and supplies. Contactless deliveries are allowed. They will be monitored through smartphone technology, and regular random phone calls to verify compliance will be made. Participants will be charged $1,000 to cover basic costs like transport and the other associated costs with the pilot. That is less than what they would pay if they were in MIQ, because of course it is a less intensive service and we're not providing them with food. When they return to New Zealand, participants will have to have a negative pre-departure test. They'll be screened and tested on arrival in New Zealand as well. That's what we currently do for those who are entering into our MIQ facilities.